Wait, what? I can do that? This is Eric Bell with Wait, what? Financial matters that matter for business and the people that own them. Thanks for watching us today. I have Dr. Mitch Wainwright with us, who's my doctor. I call him Mitch, so you're going to hear me use that word, but he is a doctor. And went to UC Berkeley for his undergrad, UCI for his medical degree, and now he works for Optum in Ladera Ranch here in Southern California. Before we start, Mitch, I want to tell you about the golden pig.
Okay.
Her name is Karen. Anytime you use an acronym, $5 goes in the slot.
I see that.
So don't use an acronym.
I will not.
Okay. All right. So can you give us an update on COVID? That's kind of the biggest and hottest thing going on right now. People are wondering what I need to do, or just give me your insight on it.
Well, what I'd like to do is give you a brief introduction to COVID.
Okay.
Basically, it's a coronavirus, and these coronaviruses have been with us for centuries, from a common cold to a severe acute respiratory syndrome called SARS, to the Middle Eastern respiratory disease called MERS, And basically, it goes from a common cold to a severe respiratory illness. And the reason respiratory illness in your chest.
Okay.
And the reason this is so important right now is that this is a novel coronavirus, meaning that we've never seen this. Humans have never experienced this strain of the virus. That's why there have been so many deaths, and the morbidity and mortality from this virus is astounding. And this is a very fluid disease. And when I say that, I'm going to read some numbers from notes that I took last week. And the notes that I took last week are no longer pertinent because the morbidity and mortality has gotten so much worse over just a week's time.
Wow.
And so I'm going to say that there's different variants of this disease, and it makes it very difficult to treat. So in ending 12/21, there were 30% people in California had the variant Omicron.
Mm-hmm.
Weekend 12/28/21, 83% of the people in California had the Omicron variant.
Wow.
Okay.
And I was one of them.
You must have been one of them.
Yep.
In California, as of the 12th of this month, there were 6 million cases of COVID with 76,000 deaths.
Wow.
Okay.
Wow.
As of the 19th of this month, they peaked to 130,000 new cases of this virus daily.
That's crazy. That's crazy.
It is. And the reason it's so difficult to catch and treat this is that it mutates. It causes variants. And I'm going to read you some of the variants that the audience may or may not have heard of these variants. Alpha variant, Lambda, Gamma, Beta, Delta, Epsilon, Mu, and now we have Omicron. So it's like a big octopus.
Going down the Greek alphabet.
Exactly.
Yeah.
Because we think we have Omicron done, and we think we're peaking here in California. But as of the last week, hospitals are filling up left and right because of this variant.
That's what I heard.
And people, I think we're starting to take the virus for granted.
Mm-hmm.
People are assuming that I've had it, or I know people who had it and they survived. Well, true. Compared to this year to last year, the morbidity and mortality is probably less with fewer fatalities,
Mm-hmm.
but still the virus is very strong in the community and is growing basically.
So, back to that, Mitch, someone asked me or told me, because I was with some of my friends, a couple anti-vaxxers, some vaccinated, and they said, now that I've had coronavirus and I've had 2 of the 3 shots, I get my 3rd one in February, that I have antibodies and I don't have to worry about it, and I don't have to wear a mask.
Okay.
I see you looking at me like I'm crazy.
No, I didn't say that. Now, I will tell you this: natural immunity does exist, so
Okay.
you can have natural immunity from this virus after an infection, but we can't tell you how strong your immunity is, and we can't tell you how long lasting it is. But we can tell you that if you've had 2 vaccines, then you have more immunity than somebody who didn't have any of the vaccines.
Right.
Okay. And they did a study that showed that people who have gotten the mRNA vaccines, either the Pfizer or Moderna, have a 35% coverage rate. But add that to a booster, and that coverage rate is all the way up to 80%.
Even against Omicron?
Yes.
Okay.
And so even though you're vaccinated partially, you still need to have caution, because I have people who have had both both vaccines, and they still have contacted an episode of this virus, though less severe.
For me, I had a headache for 2 days. I was a little bit more snotty. I got the allergy, so I was a little bit more snotty than normal. And that was it for 2 days. And I was at 90%, but I was stuck at 90%, well, for probably like the next 7 days. It was just till last Saturday, Sunday, that I felt 100%
But this is after the 2 vaccines.
after the 2 vaccines.
So that may not have been the case had you not been
Oh,
vaccinated.
I know. That's why I'm kind of glad I am now. Yeah. Hey, so when you get the booster, so my friend got the booster. She also had Omicron, and she was a lot sicker than I was. How does that?
Everybody's different.
Everybody's different.
Your immune system versus mine, we have no idea what predisposing factors would cause somebody to be sicker. But I will tell you, somebody with diabetes or heart failure or severe hypertension or alcoholism, these people who have predisposing factors, smokers basically, they will inevitably have a worse course than somebody who's healthy, who doesn't have those problems.
Oh, wow. Okay. So as far as mask wearing, all the time, sometime, around family, grocery store, obviously, when you're around people you don't know. But what's the protocol you think, or would you tell people to wear a mask?
I tell people, if you're going to be in public around people who you do not know, then you should wear a mask. If you're at home and the people in your household have been vaccinated and boosted, you don't need to wear a mask. But in my work, everybody wears a mask and it's mandatory because
Right.
I'm in the medical field. But I would tell somebody in retail or somebody in other fields that if you're interacting with the public, you should definitely wear a mask, and an N95 mask, not just a cloth mask. You want to wear an N95 that can actually prohibit those particles from reaching you.
So, Mitch, I don't wear an N95, but I wear this kind of mask. Is this good? I doubled down on this too.
They're better than nothing, but an N95 is what you need, especially if you're going to travel on an airplane or if you're
Right.
going to go to a sporting event or a concert. N95s are the way to go.
Okay. But that will help.
Oh, yes.
Doubling down, of course, helps better.
It does.
Okay.
It does.
N95 for me, though, I couldn't breathe in that thing. It seemed like it was just too much.
I agree.
Yeah. Okay.
And when I started first wearing one, it was very difficult. But
you get used to it.
You get used to it. And also, I've seen a lot of people with COVID, and I don't want to be one of those people.
Yeah. I got another friend. Her husband called me the other day, and she was in the hospital, but she has some pre-existing conditions.
Okay.
And I think she was 85% able to breathe on her own, and they were holding her over till she was like 90 something. I think that's what they were he was telling me. It was hard for him to explain it to me, and even harder for me to understand it.
Okay, so basically, we judge moderate to severe pulmonary disease by your oxygen levels.
Okay.
If you have a PO2 above 94%, that's a moderate disease. But if you're below 94%, you're tilting into the upper 80s. That's severe respiratory disease, which almost always requires hospitalization and sometimes ventilation and maybe even intubation.
Yeah, she's been ventilated. She's in the hospital, but she's now getting better because she was in the 80s, like you were saying.
So, now that person, typically when they get out of the hospital, instead of having a 5-day quarantine, like say you would if you had a COVID infection, that person, because she was so ill, that person would need 20 days of isolation and quarantine before she's able to go out into the public because she had such severe disease.
Okay. And you gave me some clarity when I got it, because I texted you. We always text each other. But where I got my test, it said I was supposed to be in quarantine for 10 days. But you knew I was vaccinated, so that dropped me down to 5.
Actually, within the last 2 years, it started out as a 10-day, but now we've learned, like I said, this is a fluid process. We're all learning that now a 5-day quarantine is adequate.
Okay.
That's even if you haven't had the vaccine or if you had the vaccine. Okay.
Wow.
Now, a lot of times you may not have the virus, but somebody who came to visit you find out had the virus. Well, that's a 5-day quarantine. But if somebody in your household lives with you and they have the virus, that's a 5-day quarantine with a mask also.
Okay. Wow. So this is complicated. It's going to get even more complicated, I guess. You think we're going to have more past Omicron?
Well, we've had 8 so far, 8 variants, and I believe this is going to be an annual thing, just like the flu became an annual. I believe they're going to take the variants that are more prevalent in society at the time of the year, put that into a immunization, And that's what they're going to offer us. This is my own belief, offer us every year, because we have to develop antibodies, and then we develop antibodies to these four. Who says in the next year another variant doesn't pop up?
Right.
So, and that's why it's important that I know people complain constantly about having to wear a mask, having to have precautions, can't be as social as they want to be.
Right.
But until we get the majority of the people doing the right thing, this is going to be a continuum. We're going to be wearing these masks. It's going to be something that if you see somebody without a mask, like me, I see somebody in public without a mask, I'm shocked. I'm surprised.
Yeah.
Because now sometimes I'll be in my car and I want to go to the grocery store. I get out of my car, walk into the store, and the first 2 steps I realize I don't have a mask on. I almost panic, hustle back to my car and put a mask on, not just to protect me, but to protect those around me.
And that's what it's about, protecting other people.
Exactly.
As well as yourself.
Exactly.
But not spreading it. Yeah. So, how long do you think Delta, I guess, was the one before Omicron? I'm told that was more devastating than Omicron.
Correct.
Okay. I mean, how so?
But, well, more devastating, more hospitalizations, more ventilations, more intubations, but the prevalence in the community of Omicron. So you have more and more morbidity with the Omicron, but maybe more mortality with the previous variants. But this one is spread, the virulence is much higher than the other variants, so it spreads easier through the community.
So what's some of the, I guess, BS that we're hearing out there that's not true in regards to the virus itself?
Okay,
I mean,
so
in the early time, there was a bunch of stuff, use Clorox and all that kind of stuff. I'm not talking about that, but I'm talking about more recently some of the stuff that we're hearing.
Well, we still have a segment of the population that doesn't believe the virus exists. And,
wow.
And they're believing that one is government manufactured. People have told me that they're putting chips in our bodies by giving us these vaccines. I'm to the point where I don't have that discussion with patients anymore. I just basically state what is following the science and trying to stay as updated as I can. And I just relay that. If they want to accept that, then that's fine. But people have to understand that they have to protect themselves, protect their family. People ask me sometimes for ivermectin, the animal parasite medication for worms in sheep, for example. They'll ask me that, can I prescribe that for them? I'll say, no, I don't do that.
Why would you take an animal stuff? That's crazy.
Because there's so much misinformation out there.
Wow.
That people are telling them. As a matter of fact, there's a representative in the state of Indiana who's trying to put forth a bill that will allow physicians to prescribe this ivermectin to people because he believes that it will help people get over COVID quicker. But yet the FDA has stated that we should not use this because there are adverse side effects that yet we don't even know about.
One of my friends was saying, double down on my vitamin C, zinc, all that kind of stuff. Is that something that might help you down the road, or help you help you not even get it?
Okay, so supplements are an interesting phenomenon. If you have a normal balanced diet and you're getting your adequate rest, exercise and not stressing, you probably don't need a supplement. But if you're doubling and tripling up on your supplements to help, thinking that it's going to help you prevent getting the virus, most likely you're urinating those supplements into the toilet and spending a lot of money that you don't necessarily have to.
So supplements don't really do what they're cracked up to be?
Supplements are necessary if you have a deficiency.
Okay. So I remember when the virus first came out, I went to go get zinc. The shelf was clear. There was nothing there.
Well, if you're
vitamin C, there was nothing there.
Well, that's not only it. If you remember in the first days of this pandemic, when you went to the grocery store, people were panicking.
Oh yeah.
They're getting the last can of beans, the bread,
all the
water,
paper.
all toilet paper, exactly.
Everything.
And so we've bypassed that, thankfully, because those were scary times.
Right.
I have to admit, in my garage, I was stacking up food and water.
Right.
I wasn't going gung-ho on the toilet paper, but maybe I should have, because without toilet paper, life gets rough.
That's right. Real rough. You gotta use a paper towel. Yeah, I was going to ask you if we can just kind of downshift. I want to skip into men's health and women's health.
Okay.
You've been my doctor for over 20 years. I come to you. Long time ago, it seemed like with prostate, I got the old finger. And you made it romantic for me, so I'm not complaining. But it seems like nowadays you don't need that. I mean, can you talk more about the prostate? Because I know a lot of men, they don't want to get their prostate checked because I don't want anybody sticking their finger up my butt. But, tell me how that works now.
Okay, so the American Cancer Society has determined that if you are current with your colonoscopies,
Which I am now.
Okay. So it's 10 years if they found nothing on your prior colonoscopy, 5 years if they found a small polyp, maybe every 1 to 3 years if they found multiple polyps.
Mhm.
But if you're current with your colonoscopy, you don't need a digital rectal exam during the exam unless you have symptoms of a prostate infection or a prostate obstruction in men over 50 called benign prostatic hypertrophy, where you have difficulty urinating or maintaining the stream of urination that you'd like, or you're getting up multiple times during the night to urinate. Then we do a digital rectal examination to determine what's our next course of action.
Okay, so that's to feel if the prostate's enlarged or something of that sort.
Exactly.
Okay, other than that, you're just doing a blood test.
Exactly.
So current on your colonoscopies.
True. But the blood test, the PSA,
Yeah.
Basically, there's a high prevalence of this disease, prostate cancer, in African American males.
Mm-hmm.
So screening in my office and multiple offices around the country is at 40 years of age, we start screening African American males. At age 50, everybody else gets screened unless that person has a family member who had prostate cancer 10 years prior to that 50, or excuse me, 10 years after, within that 10-year period of 50 to 60 years of age. So they get earlier screening.
So as far as men's health, I mean, that's the big one, I think, the prostate thing that guys are afraid of going to the doctor about. But I have some clients who haven't been to the doctor in 20 years.
Okay, so I'm going to give you my belief system here. Women are smarter than men.
Yes, they are.
But they're also put in a position to succeed medically than men are not, because that's why they live longer. You think of a young woman or adolescent, 11, 12, 13 years of age, their first issue is, I'm having periods, I'm having my periods too heavy, I haven't had a period. So then they go to the doctor.
Mm-hmm.
So that's their first interaction. Then they become late teenagers, early 20s, then they want birth control.
Okay.
Or they need a pap smear.
Mm-hmm.
Or they even get pregnant.
Mm-hmm.
So then they're in that for the next 10 years, so 30s into their 40s. Then late 40s and 50s, hey, my period's stopping. I'm in menopause. So at adolescence, in the 20s, 30s, 40s, 50s, 60s, and beyond, they're constantly seeing their doctor.
Mm-hmm.
Now, their doctor's also saying, hey, well, let's get some blood work and check your cholesterol and check you for high blood pressure. So they're getting all these things around their female visits.
Mm-hmm.
So that's why they are smarter than we are. Now, a guy, unless you're an athlete in high school where you get a pre-participation physical, you don't get a physical.
Right.
And then you go through your 20s, nothing's happened. You go into your 30s, nothing happens. Then you think, well, maybe I'm at 40, maybe I need a physical. But some guys don't even come in until they're 50.
Right.
All of a sudden, there's 30 years there where we could have been screening that nothing was screened. And so they come into the office in their 50s and 60s, and all of a sudden, their blood pressure's been high. Well, that blood pressure works on your kidneys, your heart, your penis, your brain every day, 24/7.
Mm-hmm.
And all of a sudden we have end-stage disease because we didn't pick this up earlier. They could have diabetes. But if they had come in earlier for screening, we could have helped them with that. So there's a lot of things that you say men don't go in, and a lot of men take pride in not going to the doctor.
Right.
I have a lot of guys say, I haven't been to the doctor in 40 or 50 years. Or a very common one, well, my grandpa smoked until he was 85 and smoked 2 packs a day and never needed a doctor.
Mm-hmm.
Well, these are rare events. And I say that if you want the population to be strong, you have to get screened and you have to be smart about it.
Yeah, that's true. I remember when I have high blood pressure, as you know. When I first met you 20 years ago, I was taking 100 milligrams of that one pill you prescribed to me.
Mm-hmm.
And you told me, Eric, you got to make a lifestyle change, in terms of my diet. Did that, and I'm on 10. Probably don't even need that anymore. But, I'll wait for you to tell me that. Yeah.
Well, it's all about doing all the right things as best you can. Consistent. Now, if you know your parents had high blood pressure, both parents,
mm-hmm.
and you haven't addressed that or haven't even had that looked at, then you're being foolish.
Right.
Because apples fall off of apple trees.
Mm-hmm.
If both parents had high blood pressure, most likely the child will also have the high blood pressure.
No.
Unless the parents had bad social habits.
Yeah, and a lot of our parents are from the South, and they had, they were eating all kind of stuff, and so did we. So that's why the blood pressure went up and gaining weight. With women, though, something I've been hearing a lot of is breast cancer and thyroid problems. It seems like I never heard of a guy having a thyroid problem. What's going on with thyroid in women?
Well, thyroid disease is more prevalent in females.
Okay.
But trust me, men do have hypothyroidism, hyperthyroidism, Graves' disease, and other diseases associated with the thyroid gland. But women, if they just have a higher prevalence of it.
Is there something you can do to kind of prevent that from having a hyperthyroid when you're younger, so you don't have it when you're in your 40s or 30s?
No, it's most likely hereditary, or unless you had a viral infection that shut down your thyroid gland. There's nothing you can really do. As far as breast disease, we are seeing more women with breast cancer because we're doing such a good job at breast screening.
Okay.
Okay, so we're definitely on that diligently screening these women, and we have better tools now. We have MRIs of the breast. Okay, we have diagnostic mammograms versus a screening mammogram, so it's a much more thorough evaluation of the breast, and we're doing a good job screening most everybody in most everything. So healthcare has come a long ways. We have a long ways to go, but we're doing a much better job than, say, when our parents were our age.
Right.
And I bring this up a lot. When I was younger and my parents' group of friends, they were in their 60s, we never saw a case of Alzheimer's or dementia or anything like that. But now it's so common because people are living so much longer. So now we have people 80s, 90s. I have a good many people in my practice above the age of 90 functioning, doing well. But I also have people 70, 80s, 90s who have dementia. And who says why? There's no rhyme or reason, but we're seeing it because people are living longer.
Yeah, living longer is a big deal. I mean, so a lot of people are going to live to 100. A lot, I would think if they treat themselves right.
Well, my mother-in-law is currently 96, so there's no telling if you do the right things. There's no telling how many numbers you can accumulate.
I had a Time magazine. It's in my briefcase. I wish I had it, but had a kid on the front. This is a couple years ago, and it said, "This young baby will live to be 134." I was like, wow. I guess with medical advances, that's where it's going, huh?
Well, I hope I don't get to 134 because I sure look terrible.
You probably won't. You probably won't. Back to you were saying we're doing more. Let's talk more about COVID. One of my friends, anti-vaxxer, said the reason there's more COVID out there is because we're testing more. If we didn't have all these tests going on, well, I mean, it doesn't make sense to me, but we're testing more. That's why the numbers are going up.
Okay, so the people we're testing more are the people who refuse to get the vaccine or the booster. So
those that feel sick.
Right.
Yeah. Okay.
In a lot of workplaces, they're demanding probably 2 tests per week if you're not vaccinated. So you figure in a month's time, that one person has had 8 tests. And so you multiply that by the number of people who are not vaccinated. That's amazing. I have a stat here. In California, 66 million people have been vaccinated for COVID vaccine.
What's out of our overall population?
I think we're in the 30 millions.
Okay.
And if you figure we have 182,000 people a day getting vaccines. So California's doing a really good job. But what I'm concerned about, and this came up last week, the California Department of Health came up with an idea, because healthcare workers are getting decimated by this virus, is simply that they have decided that a healthcare person who is asymptomatic but has a positive COVID test can return to the workspace, and they're saying that person can work with COVID patients.
I just heard that the other day on the news.
And people are alarmed. I'm alarmed at that.
Yeah. But
I understand where they're coming from. For instance, in my office, we screen people, cough, cold, and we ask people, have you had if you have one major complaint, are you short of breath? Have you lost taste or smell? Do you have a cough, or do you have a fever greater than 100.4? That's a major. One major automatically sends you home for 5 days. But if you have 2 minors, I have a runny nose, I have body aches, I have a headache, I have nausea, vomiting, diarrhea, 2 of those, you're home for 5 days. So somebody presents to my office, we ask them these questions, and some will tell the truth, some will not tell the truth. And so we find out later that they tested positive for COVID.
Right.
So my receptionist, my nurse, and my provider who saw that patient are now out of the office for 5 days. And I want you to imagine this happening 2 or 3 times every week, how that's decimating healthcare. There are certain offices I know have had to close because they don't have enough staff, because of COVID is constantly circulating in their office. So it's decimating healthcare right now. And then you have healthcare fatigue. You know, people who don't see it every day don't realize that this takes a tremendous toll.
Mm-hmm.
I mean, one, we're constantly changing the PPEs. We do visits in the car. We do Zoom visits. We do in-office visits if they're healthy enough. But then we have to deal with the non-vaxxers, the people the non-believers who don't believe in science. They constantly want to challenge us with arguments, and so after a while, a fatigue level sets in where we're tired of it. But this is what we do. But we would really appreciate it if everybody would do the right thing and protect themselves and everybody else around them.
Mm-hmm. So, point of clarity: if you had the vaccines and you've had COVID, you can still catch it again.
Absolutely.
Got to wear that mask.
You have to wear the mask.
Yeah.
The greatest benefit is to have had your vaccines and your boosters. Now, I'm going to tell people that say you've gotten COVID and you're not vaccinated, then you need to wait 90 days from the date of your initial positive test before you can get vaccinated.
Yeah.
But if you're vaccinated and you got COVID, as soon as you're over that 5-day period and you're healthy, you can get boosted right away.
Okay.
So
that's good to know.
There's time to wait. Now, Pfizer has actually lowered the age that somebody can get a vaccine to 5. So that 5 to 17 year age group, they can get vaccinated. Moderna says at age 18, you can get vaccinated. So they're working their way down to get as many young people as they can vaccinated against this terrible virus.
Yeah, for my daughters, it was a terrible last 2 years, not being able to go to school and socialize with their friends. Now they're vaccinated, but it was pretty bad for them.
I agree with that,
Mm-hmm.
and I'm sorry it had to happen. But imagine the seniors who have X amount of time left on the planet,
right,
and yet they're in the hospital by themselves, can't have visitors, or they're at home by themselves, can't have visitors.
Mm-hmm.
Thank goodness in this day and time we have Zoom and Doximity and FaceTime that we could deal with that. Imagine years ago where you told that person to stay home and they had no communication with the outside world other than a telephone.
Mm-hmm.
So things have improved, but we need, as a nation, as a people, we need to continue to do the right thing.
So as you get older, your immune system starts to
absolutely
go down.
There have been some studies that it starts to decrease probably in your late 20s.
Oh, really?
And then as you get older, your immunities start to decrease. Yes.
But if you take good care of yourself, exercise, and all that kind of stuff, you kind of bump it up.
You bump it up, but you're also dealing with genetics.
Okay.
You can never run from your own genetics.
Okay. All right. Women's health. Anything we should know in addition to what we've already talked about?
No, I think we're doing a good job with the women. And they're actually, they're doing a good job with themselves. They're very screening oriented. They're getting their bone density studies for osteoporosis, their mammograms we spoke about, their pap smears, their lab work. So yeah, and they're very motivated. And we live in a state where we have a very motivated population. I think this is a state that probably has the fewest smokers,
Yeah.
And maybe other than Colorado, I think we may be one of the healthiest states as far as exercise and things of that nature. So we're actually doing well. Parts of the South, you go down there to visit, and the obesity levels are off the chart.
Oh, yeah.
Hypertension and everything else. So I think at this time, California's doing well. But we just need to step up and do the right things with our masks, vaccines, and boosters.
What about men's health? Anything that we should know, or we should be paying more attention to, or guys should be paying attention to?
Well, I think men's health, I think we need to have earlier screening. I think ask somebody in their 30s to get screened, no. But I say 35 and 40, go on and meet and greet your doctor. Let them take your vital signs, discuss any issues you have, and start that relationship. And I think the longer you have that relationship with your physician, the longer you'll live.
Yeah, you've been my doctor for, I think, 20 years now, if not longer. And, for me anyway, to be able to text you or call you and say, hey, this is what's going on, you tell me come in or whatever, that's of great value to me and my family.
Well, it's not just people who have my phone or texts, it's other people in the office. I mean, we try to make ourselves very accessible.
Mm-hmm.
And I find that the more accessible I am, the healthier you are.
Well, and everybody has this telemed thing now.
Exactly.
So they can, you can just get on the computer and talk to them or do a Zoom with them, basically, I guess.
Exactly. And it's very helpful. One we have a situation where, as the older folks, the seniors who don't actually have access to the computers or don't have the computer knowledge, that's a situation where we're trying to address to give them more access to healthcare.
You know, Mitch, can you talk more about Optum and your group and what
Okay.
you do with them exactly?
All right. So Optum, this is my 4th year with Optum. I was initially with another medical group and decided to go into private practice for 13 years. And Optum approached me and they wanted to purchase my practice. I was a little bit hesitant initially, but then it was funny. I was watching a golf presentation that said sponsored by Optum. And I was watching the Super Bowl, sponsored by Optum. And I started thinking to myself, Optum must be a pretty good deal. So I did my research and I've met a lot of people, and it's been a very good career move for me. Very socially oriented, excellent medicine. They're a national company. I was playing in a golf tournament in Albuquerque, and within a 10-minute span on the freeway, I passed 2 Optum offices, and I'm thinking, wow, in Albuquerque. Wow. So it's a national organization. It's a leader in healthcare, and very happy to be with them.
Okay. And you're in Ladera Ranch.
Yes.
All right. If you want to get hold of Mitch, you can always call me at area code 714-643-2500, and I'm at extension 420. And you can call the Optimum office in Ladera Ranch if you want Mitch to have a conversation with you.
And that's 949-364-9112.
All right. Thanks for being here, Mitch.
Eric, thank you for having me. I really appreciate it.
All right. And you don't owe Karen any money, so you made it.
Well, thank you, Karen.
All right.